Dr. Mary DiBartolo, Associate Professor of Nursing at Salisbury University and host of Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. The topic of today's program is Civil War medicine, and it's a very special edition with a very special guest, Dr. William Cambell, my colleague at Salisbury University Department of Nursing. Now, you're an assistant professor of nursing, and you also have a keen interest in Civil War medicine. What got you interested in that?
My interest in Civil War medicine really started as a youth, probably about 10 years old, when my aunt took me to quite a few Civil War battlefields. That interest continued throughout adulthood, and a few years ago I decided to put that together with my profession and my career, being as a registered nurse, and started looking at what went on with nursing and with medicine during the Civil War.
And I'm sure our viewers can't help but notice that we're both in period dress. Maybe tell our viewers a little bit about what exactly we're both wearing.
Okay. Your dress is simply a Civil War period dress. Would be a day dress that a nurse would probably be wearing during the daytime. Very plain, no ornamentation whatsoever. The apron you're wearing is a pinner apron, very unique in the fact that the aprons of that period did not have neck straps. The bib part of the apron actually had to be pinned to the dress. My uniform that I'm wearing is that of a Civil War Confederate major or surgeon. The frock coat, and that's what this particular type of coat is called, a frock coat, and the vest underneath are both gray. I would be wearing, with the gray, I would be wearing blue pants, and if I were wearing my hat, a kepi hat, it would also be blue. Many people thought the Confederates only wore gray, and no, at the beginning of the war they wore gray, but also mixed with blue depending on the particular unit. Later in the war, the gray uniforms actually would have changed to brown uniforms because they ran out of gray material because that was imported.
Oh, interesting.
This particular uniform would be that of a major, which would be a surgeon. An assistant surgeon would be a captain. And the star on the collar indicates the rank of major. The double-breasted jacket indicates major or above. Also, the 3 braids on the sleeves would also indicate major or above. Black cuffs, black field behind the stars, black stripes on the pants would all indicate medical service. And the green sash that I'm wearing around my waist would indicate also medical, and the color green alone meant medical because nurses, male military nurses, hospital stewards would also wear green chevrons on their sleeves, and the green meant non-combatant, so that was kind of self-protection.
Now, did nurses wear caps at the time?
No, they did not. They would have worn some type of netting or something to control their hair, but no caps.
Now, I know you've done lots of presentations in the local area on Civil War medicine, but are you a reenactor?
No, and I like to make that point that I am not a reenactor. I do not go out on battlefields and sleep on the ground overnight or run around shooting a gun. I'm a living history interpreter, which means that I go out and I do presentations. I talk about the Civil War. I try to dress in uniform whenever I go out to talk to make it a little more authentic. And the uniform that I wear is in particular authentic to the time period and also to all the military regulations. So I try to make it authentic in that respect. I like talking not as a reenactor but as an interpreter because first of all I'm able to talk in third person, never trying to act in first person. And it also does not tie me into any one particular day. It's more of a period so that I can talk about what happened in 5 or 10 years before the Civil War, what happened as a result of the Civil War, and 5 or 10 years later.
And for those of us that aren't history buffs, what is the period of time we're talking about of the Civil War?
For the Civil War, we're talking about 1861 to 1865.
Now, now we can get into the nitty-gritty.
Okay.
I mean, talk to us about the state of medicine and nursing at the beginning of the Civil War period then.
For doctors, let's start with doctors. A doctor, and we think about the title of surgeon, did not necessarily mean the person had ever done any surgery. If they had been to medical school at all, it would have been 2 years. They would have been seated through lectures or theory content for 1 year, would have gone back a second year and sat through the exact same lectures a second time. never having any clinical, no labs, no hands-on patient care whatsoever. Everything would have been theory content, and they would have come out as a doctor, and for the military as a surgeon, may never have taken care of a patient, may never, certainly have ever seen a battle wound or a bullet wound.
So strictly on-the-job training then,
On-the-job training,
like.
oh yes. For nurses, no training, no education whatsoever. If you were sick, you normally had a family member volunteer to take care of you, so all the nurses were volunteers. In the military, they did have nurses, but the nurses were convalescent soldiers. So once a soldier was over his initial illness, was not sick enough to be in bed, but not well enough to be back out on the unit on active duty, he would in turn take care of soldiers who were more ill than what he was. So it was really part of his rehabilitation.
Were there any other resources available at the time to take care of the casualties of war?
Not really. At that point in time, there were no hospitals, very little medical supplies. In fact, the Surgeon General for the North at that period felt that he had to wait and see how many casualties there were first before he even ordered supplies. So there were no plans, no supplies whatsoever to take care of these soldiers. When you start to think about what happened after that, I mean, we had 620,000 deaths during the Civil War, over 6 million cases of disease that were taken care of. And to handle those kind of numbers at the very beginning of the Civil War, we had 115 surgeons. And that for both sides, and then of course once the first shots were fired, part of those resigned from the North and went to the South. So total, 115 surgeons.
Wow, that's definitely not meeting the demand, huh?
No, definitely not.
What was the ultimate challenge of the Civil War for the surgeons and nurses that worked in the battlefields?
Interestingly enough, it was not the battle wounds. It was diseases. Diseases, if you look at the number of deaths during the Civil War, diseases to battle wounds were 2 to 1. So 2 people were dying of some disease for every one that suffered from an injury or a death on the battlefield.
So what kind of diseases were there?
Diarrhea, dysentery, malaria, tuberculosis, typhoid fever, diseases that we really don't stop to think about too much today. And interesting enough, diarrhea was the #1 killer. We don't even think of that as a disease today. We usually think of that as a sign or a symptom.
More so because of the dehydration that results?
Because of the dehydration, the electrolyte imbalance, the fact that at that period in time there was no treatment for that. So yeah, but the diarrhea alone claimed 48,000 men in the Civil War.
Well, lucky for us today, we have better sanitation and immunization, so I guess that's what's been the biggest change since that period of time.
Yes.
Now, I often heard that amputations were actually done in the field without anesthesia. Is that true?
No, it was not. That was one of the myths that was spread throughout the newspapers, the journals at that particular time. It's still carried over in the movies today. Ether and chloroform were both being used during the Civil War, widely used. In fact, the documents that were kept, which are fairly accurate, show that the only time they were not used were about 200 cases when they actually ran out of them. But they were used most of the time. What really created that myth was the fact that all of the surgeries were conducted outdoors because of lighting at that particular time. And because of the mass casualties, they would grab a door or a shutter, throw it across 2 sawhorses, and that was an operating room. And it was always outdoors because of the better lighting. That also meant that other soldiers were walking by while the surgery was going on, the amputation was occurring. And what they would see was a patient laying there having an amputation, and the patient was moaning and moving. What they didn't realize that anytime you use anesthesia, there are different levels to it. And as you start giving the anesthesia, the most shallow level, the patient is asleep and is suffering no pain, but they're still moving and they're still moaning. And if you take them to a deeper level, they stop moaning, they stop moving, but they also stop breathing. And at that period of time, there was no way to ventilate those patients, so they had to keep them at that more shallow level. So the soldiers walking by, they would see and hear these things. They would immediately write home and tell their families that this was happening. Those letters would be published in the newspapers, and that's how that myth really got started.
That's interesting. Now, I noticed you brought a case that has some interesting surgical implements in it, including a saw. Would you like to describe some of the items in there?
Okay. Well, first of all, you've mentioned the saw. And this is exactly what you think it is. It is an amputation saw or a bone saw. This would have been used to cut the bones in arms or legs as the amputation was occurring. And you have to realize that during the Civil War, about 3/4 of all surgeries that were done were amputations. And amputation was actually the most effective way of saving these soldiers' lives. If you did not amputate within 48 hours, usually infection would take over and the chance of survival was much less. In this particular case, we have the amputation saw. We have a series of scalpels down here, which would be used to cut through the skin. These 3 items are amputation knives, which would be used on the muscles.
I know, I'd love for you to pick them up, but you said they're very sharp.
They are very sharp and will still cut just as quickly as they did in those days. There's also a tourniquet in here to control the bleeding. There is an instrument which looks very much like a hook, which are located back here. They're called tenaculums, and they would reach into the stump, grab hold of an artery that might be bleeding, pull it out, and then tie it off using black silk or later horsehair.
Yeah, I was wondering how they would tie off the blood vessels. So they used suture material back then?
Yes, at the beginning of the Civil War, it would have been black silk. The problem was that later during the Civil War, the blockade stopped all of the black silk coming in from the Orient. So the South had to find a substitution, so they actually went to horsehair, which was kind of an interesting story in itself, because in order to make the horsehair flexible enough to tie, they found they had to boil it. And they couldn't really understand why, when they used the horsehair, they had less infections than they did with the unboiled or unsterile black silk.
Well, that's interesting. We've learned a lot, haven't we, in medicine with infection control and such.
Yes.
Now, getting back to the saw and the anesthesia and the amputations and the myth that they were done without anesthesia, do you think that's the main reason why most people have the impression that medicine and healthcare were so poor back then?
That's really part of it. I mean, the other thing that you really have to keep in mind is, if you use the old saying that everything is relative. 1860s medicine was based on the knowledge of the day, what they believed in the 1860s. At that point, there absolutely no idea of germ theory. They had microscopes. They had seen microorganisms. They knew that bacteria and fungus, parasites existed, had never seen a virus, but they had never put that together with the disease process. So as a result, hand washing was not important. There were no antibiotics. If they used the instruments in this case, they would not have been sterilized between patients. In fact, they probably were not even washed between patients. The surgeon would have wiped it off on a rag or on his apron and gone right on to the next patient. As a result, tremendous amounts of infections.
So what were exactly the developments in medicine during the Civil War period that definitely helped improve healthcare?
A lot of events happened during the Civil War based on the demands, the limited resources, the developments, the inventions. If you tried to go down the list, we'd be here all day just listing all of those. Just to look at a very few of those, one of those being the surgical review teams. We started off in the Civil War with a surgeon doing an amputation based simply on, well, he needed the experience or he thought that this guy needed an amputation. Dr. Letterman came along, he said, let's have review teams. 3 surgeons have to look at this guy's wound. They all have to certify that he needs an amputation. We have the same exact thing today. We call it second opinion. So, I mean, that's one. If we look at hygiene, the idea of where's the drinking water coming from? How deep is the well? Where is the water being obtained from the stream in relation to where the latrines are? I mean, and we certainly have all of that today where we're concerned about drinking water, chlorination, bottled water. We worry all the time about the safety of the water. One of the big ones was simply the training and the education of the personnel, whether it be the nurses, the surgeons, the ambulance drivers, the ambulance attendants. Beginning of the Civil War, no training whatsoever. They just grabbed whoever was handy and said, do this job. And then later in the war, we saw people dedicated to positions, trained for those positions, even down to the ambulance attendants. And of course, we see the amount of education and training that goes with all of the healthcare personnel today. And that is actually a carryover from what happened during the Civil War. Another one is triage. At the beginning of the Civil War, there was mass confusion when there were casualties. There was no triage.
Well, explain what triage is.
Okay, triage means that the patients who need help first will be taken care of. Those that cannot be helped will be made comfortable and allowed to die peacefully. Those that can walk to the first aid station will get themselves there.
So someone makes that decision.
Someone actually makes that decision and labels that person as to what type of care and what speed of care they're going to get. Carried over again to today, you walk into the emergency room and you have a sore throat, you're going to wait because the person with the chest pain is going to go before you. It's not first come, first serve. It's based on triage.
Well, what about nursing? Florence Nightingale lived during that era. Was she, did she have an impact during the Civil War and Civil War medicine per se?
And Mary, I know you love Florence Nightingale, so
She's my hero.
I would have to say the answer is really yes and no. Directly hands-on patient care, no. She played absolutely no part in the Civil War. She was not in the country during the war at all. She was quite busy over in England. Indirectly, huge impact on the Civil War. If you look at everything that she discovered during the Crimean War, all of the research she did, the statistics she kept, the publications, the political action, I mean, huge impact. 1859 to 1860, depending whether you're looking at the European edition or the American edition, she came out with her Notes on Nursing, which talked about the importance of ventilation and hygiene and isolation and diet. And this had just been published 1 year before the outbreak of the Civil War, so everybody in America was familiar with what she had found and the dramatic results that she had created, the changes she had created in that war, and they were very anxious to apply what she had talked about in her publication to what was going on here.
And much of her work had to do with sanitation and the environment and helping reduce infection. So obviously that was a key issue during the Civil War.
Yes, most assuredly.
Now, what did nurses do who were working during the Civil War out there in the field that impacted the health care for the soldiers?
Nurses were, later in the war, nurses were volunteers. Actually, at the beginning, a few military nurses, which were put into those positions with no training. Later, that shifted to volunteer nurses as the demands kept increasing. A couple nurses that played key roles in that, one of those, probably one of the most famous ones being Dorothea Dix. You have to keep in mind that, first of all, military nurses were men. There was no such thing as a female nurse at the beginning of the Civil War. The whole shift that occurred in that 4-year period from male nurses to female nurses almost exclusively was the result of Dorothea Dix and her idea of creating a nurse corps, which was a whole new concept. The other thing that was probably more important with Dorothea Dix was the education of nurses. At the beginning of the Civil War, no education, no training, as I mentioned earlier. Dorothea Dix not only said we need female nurses, we need lots of nurses, although her numbers were way too small to handle the demand. She said we have to train and educate these nurses. And she actually created the first training program, which was for her nurses. She brought in a person by the name of Dr. Mary Walker, who was a female physician, so you can imagine how well accepted she was in the Civil War. She couldn't find a job as a surgeon, so she came in as the first nursing instructor and started training the nurses to take care of the soldiers. Probably another nurse, and probably my favorite, is Clara Barton. Mm-hmm. Clara Barton was a volunteer. She never got paid 1 cent for what she did in the Civil War. She actually worked a full-time job, 8 hours a day, and then left and took care of soldiers the rest of the day and paid for all of her own supplies for them with her own money. She was a volunteer, certainly a fantastic example of leadership, just an all-around exemplar.
And didn't Clara Barton help establish the American Red Cross?
She started during the Civil War simply doing hands-on care as a volunteer. When the Civil War was over, she wasn't done. So she went on and established the Missing Men's Bureau, in which she was actually pretty much solely able to identify 22,000 MIAs, and then also went on to Andersonville and identified the soldiers that were buried in the unmarked graves there. And as a result of those two events, which were actually after the Civil War, she went on to become president of the American Red Cross.
A great history lesson we're getting here today. I also know that you brought a tray with dressings and other items. Would you like to show us that? Is this what nurses used actually out in the field to take care of wounds?
This is what nurses would have used mainly in a hospital to take care of their patients, to do dressing changes. That would have also been carried by a hospital steward, an assistant surgeon, anyone who was going to do a dressing change. In the tray, you can see there are bandages, and the bandages at that period of time would have been held on with brass straight pins. There were no safety pins, no tape, so they would have had to been pinned on. They would have also used things like plasters or lint in addition to these roll bandages. Other things in here, you're just looking at the tray. This is a syringe from the 1860s. This is an authentic one. This was used primarily for irrigations, though. When we talk about syringes and injections in the Civil War, we're talking about irrigations. We're also talking about enemas. We're rarely talking about an injection of medication into a person's tissue.
And obviously that's made of glass.
And that is glass and no needle on it. We also have sponges over here. We have a pin cushion, and in it we have lots of brass straight pins for our bandages. We also have, for the nurses, some needles.
They look authentic, are they?
They are, and black silk attached to those so that if the nurse needed to close an incision that had opened, she could do that.
It looks like something you find in a sewing kit today.
Very similar.
Or perhaps from my mother's era, however.
Very, very similar. Also over here on this end, as far as on both of these ends, these are called invalid feeders. And these were used to feed tea or broth or very thin soup to the patient who was having difficulty swallowing. In that time, the wounded, the sick had a lot of intake with liquid diets. So this would have been used to make it easier for that person to swallow, at the same time not messing up their clothes, because we really didn't want to have to wash the clothes as often. Back up here we also have what's called ligatures, or black silk, where if an artery or blood vessel started bleeding, the nurse or whoever was doing the dressing change could just pull out one of these and tie it off to stop the bleeding.
Now that looks sturdier than the horse's hair, is it? Or
yes, it's much heavier. And this is the black silk, but of course the South would have run out of this before the war was over and gone to the horse's hair.
Now, is everything in this kit authentic, or some are replicas?
In this particular tray, most of it is reproduction. Most of these items would not have survived 150 years. The invalid feeders are authentic, and also the syringes and the needles.
Because I know your other kit with all the knives and surgical implements, that all was period authentic.
That was period authentic, yes.
Now, I know you brought another item to share, and that is...
This item is a nurse's lamp. And I know with Florence Nightingale, we often think about the nurse's lamp or the lamp of knowledge, and that was pretty much unique to Florence and to the Crimean War, was not associated with the Civil War. This would have been a lamp much more widely used during nurses. It actually had two uses. Talk about multitasking. It is a lamp, and there's an opening down here where the light would come out, handle on the back that the nurse would carry it with, so that if she were making rounds at nighttime, she could see her patients. The other really neat thing about this is that on the top of the lamp is a little pot, and you can lift the lid and see there's a little container in there, and this would be used to warm up teas, broth, soup for the patients, probably single serve. And I like to kid around and say that this was really the first microwave that nurses used to warm their patients' food.
Well, it looks like something you could buy at a camping store today.
Very similar.
Well, very interesting. I know you also have another special item you'd like to show us.
Yes, I do. This is a plantation-style apothecary chest. And for a surgeon in the Civil War, this would basically be his entire drugstore or pharmacy. He would carry this with him. This would be all of his medicines, drugs, ingredients that he would use to compound his own prescriptions. He may, in some cases, write the prescription, and a hospital steward may do the actual compounding. but this would represent his entire collection of medications.
And what kind of medications or compounds are in there? Because this is all authentic, isn't it?
This is all authentic. The writing, all of them have the original labels on them. They are very difficult to read. Many of them are extracts, tinctures. Some of them actually are compounds of rhubarb. So various different things. Some of them we cannot make out what the labels even say.
Can you pick one up so we can see?
Sure.
Oh, you're right. What does, can you see what that says?
No, and that one I can't even read what it says, but that is the original label. The labels on the bottles match the labels on the case itself. It was manufactured in South Carolina. Most of the bottles still have the glass stoppers.
And it's mostly powdered materials or some liquid tinctures?
Powders,
like
liquids,
said?
both. Down in the bottom drawer, in the back part of the bottom drawer, there's actually ointments and creams and small containers down there. The other thing that is down here in the bottom drawer are the weights. And these are weights that are measured in drams. And these would be used on a small portable scale, which would have been stored in this drawer in the bottom section. And that would have been used to weigh out the medications for the compounding. This particular case was carried by Dr. Thomas Palmer. He was the surgeon for the 2nd Florida Infantry. He already had this in private practice with him. He took this north to Richmond when he journeyed up there with the soldiers. Used it for probably about 1 year until he became the head surgeon at General Hospital number 11 in Richmond. He was head surgeon there for also about a year until the hospital closed, and then was located at Howard's Grove Hospital just north of Richmond.
So Bill, you're obviously quite the collector. Now where do you find items such as this?
Most of the items I have I found at various antique shops, especially in towns that are associated with battlefields like Gettysburg. That's where I found most items. This particular item came from Richmond. I was attending a Civil War show there, and if you can imagine a huge room the size of a gymnasium with muskets, pistols, swords, cannonballs, all for sale, and mixed in with all of this weaponry are a few medical items that you really have to look for, and this gem I just happened to find there.
Well, that's really fascinating, and I'm so happy that you brought these items in today so that we could take a look at them. And I know you were mentioning to me before the show that there's a special anniversary coming up. Would you like to tell us about that?
Yes. We are coming up on the 150th anniversary of the American Civil War. And of course, most people are probably quickly in their head doing the math and thinking, oh no, we've got a couple years to go before that, thinking that the Civil War was 1861 to 1865. And in reality, many people, including the National Park Service, recognize the Civil War as beginning in 1859 with John Brown's assault on the arsenal at Harper's Ferry. So we'll see beginning in this year, we will see quite a few events and celebrations pertaining to the anniversary.
And I imagine you'll be attending some of those?
Oh, certainly, of course.
And I know the other thing you mentioned is there's actually a National Museum of Civil War Medicine, specifically, giving an overview of these types of items and such, and that's located in Frederick, Maryland?
Frederick, Maryland. National Museum of Civil War Medicine is on Patrick Street in Frederick, probably the leading authority on Civil War medicine. They are also responsible for many conferences, events, educating people about this topic.
Well, thank you so much for being on the program, and what we'll do is we'll post the website for that museum at the end of the program, or any other information where viewers can get more information about this topic.
Thank you, Mary, for having me here. It was really great coming and sharing what I know about the Civil War and sharing some of my items in my collection with you. I think it's really fascinating for people to understand the Civil War, the inventions, the development of medicine during the Civil War, how the Civil War acted as a catalyst for healthcare to really move forward developments which really impact us greatly today, and most people don't realize that. Thank you.
And thank you for joining us for this edition of Focus on Health here on PAC 14.